Medication Interactions in Older Adults. This project was organized and presented by Jennifer, Rowan, Lucy, Sarah, and Margaret. Throughout this presentation, we will discuss the background information pertaining to drug interactions in older adults. This section will outline definitions, characteristics, epidemiology, and statistics. We will then discuss what we know about the subject in terms of research, ways physicians can avoid mixing medications, the prevalence of this issue around the world, and ways in which to improve interdisciplinary communication among physicians, pharmacists, in order to avoid potential drug-to-drug interactions.
Adverse effects can result from interactions between multiple drugs, drugs in certain foods, or drugs and supplements. The degree of harm can range from decreased efficacy to toxicity. This simultaneous use of multiple drugs by a single patient for one or more conditions is called polypharmacy. Managing multiple comorbidities makes managing the health of senior patients especially challenging for physicians. The incidence of drug interactions in Canada is increasing because of the aging population. As people age, biological changes in the human body result in an increased potential for illness and disease. Since the elderly are at a higher risk of having multiple conditions, they are also more likely to be taking multiple medications to control symptoms and progression of disease, and therefore more likely to experience adverse drug interactions. Adverse effects from drug interactions are responsible for up to 5% of hospital admissions in Canada per year, at a cost of more than $16,000 per hospitalization. Distribution, metabolism, and excretion of drugs can be affected by the physiological changes associated with aging. For example, loss of muscle mass and decreased total body water percentage can lead to decreased volume of distribution for some drugs. This means that less of the drug would be necessary to produce the desired effect. A decrease in organ function also affects how drugs are metabolized and excreted from the body. As we age, liver and kidney function decreases. The liver is mainly responsible for processing and metabolizing drugs so they can be excreted. With decreased liver function, the body takes much longer to metabolize the drugs. This means the drugs stay in the body for longer than needed, and the drug's effect increases, sometimes causing toxic reactions. The kidneys are responsible for excreting the drugs once they have been metabolized. With a decrease in renal function and less total body water, drugs can become concentrated in the body and cause adverse effects. As you can imagine, these negative effects that occur in healthy aging adults increase dramatically in the presence of disease and polypharmacy. Elderly people who take many different drugs for different ailments are at high risk of toxicity, organ failure, bradycardia, sedation, confusion, and falls because of drug interactions. Blood thinners such as warfarin, combined with nonsteroidal anti-inflammatories, also known as NSAIDs, or combined with sulfa drugs, which is a class of antibiotics, can result in increased bleeding. ACE inhibitors, a common blood pressure medication, combined with potassium supplements, can result in elevated potassium levels, also known as hyperkalemia. Hyperkalemia can lead to paralysis and heart arrhythmias. ACE inhibitors combined with NSAIDs can lead to renal failure. Digoxin is a drug used to treat heart failure and atrial fibrillation. If mixed with amiodarone, a drug used to treat arrhythmias, can cause digoxin toxicity, which can lead to a decrease in consciousness and difficulty breathing. Anticholinergics are a class of drug used to treat many illnesses such as asthma, incontinence, muscle spasms, depression, and sleep disorders. If mixed with antihistamines or antipsychotic drugs, they can cause confusion, blurred vision, falls, and sedation.
The study, Effective Multiple Pharmacy Use on Medication Adherence and Drug-to-Drug Interactions in Older Adults with Medicare, looked at the use of pharmacies and how they may influence the likelihood of negative interactions of drugs in older adults. The study was based on adults using different pharmacies rather than one single pharmacy to fill 2 or more prescriptions. They used a participant group of adults 65 years and older and found that 38% of the population did use multiple pharmacies. Within that 38% of multiple pharmacy users, they showed higher values of non-adherence to correct use of medication, thus leading to higher chances of drug-to-drug interactions. However, there was a similar chance of drug-to-drug interactions with those using single pharmacies. The study concluded that there was a higher rate of misuse of the drugs rather than negative drug-to-drug interactions. This study was also unable to find out information about specific interactions that were occurring within each participant. They were able to find out that 4.1% of participants that are using multiple medications could have a drug-to-drug interaction, and those who filled their multiple prescriptions using multiple pharmacies were more likely to have a possible drug-to-drug interaction by 4.3%. The study was also able to conclude that of those individuals that were using multiple pharmacies from their current prescriptions, 38% of the users could have a possible drug-to-drug interaction because of the different prescriptions from each pharmacy. This could mean that the pharmacists are not warning their clients about the use of these drugs. Of the 38%, 8 out of 10 participants could have a likely drug-to-drug interaction from warfarin. Doctors and pharmacists must take into consideration the use of other drugs that the individual is on and make sure they do not prescribe drugs that will affect each other. Poor communication between pharmacists and their client was one of the top reasons for misuse of drugs in this population. Overall, this study was well done as far as finding the implications within pharmacies and prescription drugs. However, a study based on the actual drugs that are prescribed and their exact interactions with other drugs needs to be done in order to gain a better understanding of what occurs when these are taken together. There is no studies currently pertaining to this information because in order to gain the data that's needed, this would pose some major ethical issues.
The increase in prevalence of multiple chronic conditions among older adults is no myth. All around the world, seniors are being forced to take one or more medications for various reasons. Canadian statistics were scarce, however, we were able to find one article that outlined drug interactions in the elderly. A new report by the Canadian Institute for Health Information reveals that about 61%, or about 2/3 of seniors that live in long-term care facilities, take 10 or more different prescription drugs. On the left, Figure 1 displays the number of drug classes a senior is taking in 1 year in Alberta, Saskatchewan, Manitoba, Ontario, New Brunswick, Nova Scotia, and PEI. A drug class is defined as a set of medications that have similar chemical properties and effects. It is possible, if one drug class is being identified for an individual, that the person could be taking more than one prescription drug within that class. Overall, the use of antiplatelets used to treat heart disease and hypertension, and statins, drugs that lower cholesterol levels, are reported to be the most common drug classes used in 2010 to 2011. Studies show that these numbers have only increased since 2011. Table 1 on the right displays the top 10 most commonly prescribed medications in 2010 to 2011 in Canada. The more commonly used medications fall under hypertension and cholesterol maintenance and prevention as well. Here are some examples that are worldwide. In the United States alone, 1 in 6 American seniors risk life-threatening conditions from interactions between drugs and supplements. The article, When Drugs Collide, states that 1 in 3 seniors use 5 or more prescriptions, and that 2/3 of seniors use prescriptions along with dietary supplements or over-the-counter medications. This rate has doubled since 2005. In Sweden, it was found that potential drug interactions in people aged 15 to 95 years is estimated to be about 14%. This means that there is communication issues between pharmacists, doctors, and citizens. Although drug interactions may seem inevitable, with so many elderly people suffering from multiple conditions, there are ways to improve the issue. One way to improve the incidence of adverse drug interactions is patient empowerment. This means offering patients information about the medication and allowing them to have some level of control over their healthcare decisions. Properly exercising the prescribing principles also helps to reduce the risk of drug interactions. The prescribing principles state that the prescriber should be aware of all substances being taken by the patient to avoid possible adverse interactions. The prescriber must also consider the potential risk and benefits on an individual basis and keep the patient informed. They should be monitoring medication use on a regular basis to ensure the patient is taking them appropriately. Also, the patient should be cautious when taking more than one over-the-counter drug concurrently, as they may contain the same active ingredients, resulting in more than the recommended dose for the day. If possible, less medication is best. Therefore, each patient should be clinically assessed for their specific illnesses and not prescribed more medication than necessary. Dietary modifications, such as eating nutritious foods and light exercise, may help improve symptoms of disease and lower pain levels. Implementing a drug registry where physicians can search medications quickly to see which drugs interact with each other will allow them to prescribe appropriately. Using one pharmacy will make it easier to manage all your medications, and consulting your physician before taking any over-the-counter medications with prescriptions to avoid overdosage.
In conclusion, we now know that drug interactions can be drug to drug, drug to food, or drug to supplement. Drug interactions are prevalent all around the world. Many different ages can also undergo this issue. However, more so it is seen in seniors because of the multiple comorbidities and the amount of medications they are prescribed. More attention and awareness needs to be brought to prescribing medications. And lastly, more research needs to be done on this topic. Based on the research we did and the examples we discovered, it is difficult to determine whether this is an accurate depiction of ageism. This is because seniors are a vulnerable group and are more likely to be prescribed multiple medications at the same time. Our opinion as a group is that the results we have found definitely contribute to ageism.